Hello, my name is Erica Aguilar. Today's date is September 14th, 2025. This is my video lab presentation for Biology 230, Anatomy and Physiology. The purpose of this video is to explain the difference between anatomy and physiology and learn the anatomical language. So let's begin. The anatomy is the body's structure, while physiology is the body's function. So let me give you an example. The heart. The heart's function or anatomy is that it has chambers, valves, and blood vessels that connect to it, while the physiology or the function is that it contracts blood to pump through the rest of the body. Moving on, we have the anatomical position. The correct anatomical position would be standing upright, hands at each side, palms facing forward, and legs shoulder width apart. The reason why this is important is because it provides a standard reference point in describing the body while ensuring clear communication. Moving on, we have directional terms. There are quite a bit, so if you could please bear with me while I go through and explain each one. So to start, we have anterior or ventral. That means to the front. So the chest would be anterior to the back. Next is posterior or dorsal, which means back. So the spine would be posterior or dorsal to the chest. Next we have inferior. Inferior means below or under. So the stomach would be inferior to the chest. Next we have superior. Superior means above or higher. So the head would be superior to the neck. Next we have proximal. Proximal means trunk of body, so the elbows would be proximal to the wrist. Next is distal. Distal means farther away from trunk of body, so the fingers would be distal to the elbows. Next we have lateral. Lateral means to the sides or away from the midline, so the ears would be lateral to the eyes. Next is medial. Medial means toward the midline or the middle, so the nose would be medial to the eyes. Next we have superficial. Superficial means closer to the surface, so the skin in general would be superficial to the bones. And last but not least, we have deep. Deep means farther away from the surface, so the brain would be deep to the skull. And moving on, we have the anatomical regions. To start off from top to bottom, we have the head neck region, which includes the skull, the face, and the neck. Moving on down, we have the thoracic region, which includes the lungs, the heart, and the chest. If we move on further down, we have the abdominal area, the abdominal region, which includes the stomach, the intestines, and all the digestive organs. Then moving on down, we have the pelvic region, which would include the lower abdomen, the reproductive organs, and anything that's in between the hips. And last but not least, we have the upper and lower limbs. The upper limbs would include the shoulders, the arms, the forearms, the wrists, and the fingers. And the lower limbs would include the thighs, the knees, the legs, the ankles, the toes, and the feet. And the reason why all of this information and knowledge is important in clinical practice is because it helps healthcare professionals understand the body's function and structure, and it allows for accurate testing, diagnosis, assessments, treatment, and it provides clear communication and safety. So this would conclude my video lab presentation for Biology 230, Anatomy and Physiology. Thank you for listening.